So bispecific antibodies, as I'm sure people know, are up-and-coming therapeutic agents, and they are widely used for lymphoma, particularly diffuse large B-cell lymphoma, and also for multiple myeloma. We feel CLL is quite underserved, and there's not been that many advances with bispecific antibodies in CLL. There is a real unmet need for those patients who are double refractory, who have refractory to BTKIs and BCL2 inhibitors. So these bispecific antibodies provide a good option for these patients. Bispecific antibodies are quite clever molecules, and they've got two arms to it. One attaches to the CD3 cells, and the other attaches to the tumor cells and causes synapse formation and activates the T cells. So the T cell activation is quite unique with the bispecific antibodies, very similar to CAR T, but slightly different.